Every patient that comes into our organization is different. They may come in with the same diagnosis, but they come with their own story. And that story has many pieces to it.
We've come to understand that really taking care of the whole person has a lot more to do with other factors that we call social determinants of health. Having access to adequate housing, nutritious food.
Their health literacy, their support systems, where they live.
Being able to afford their medications, or even having transportation to and from their appointments.
All of these things impact our patients and their ability to stay well.
Data shows that 80% of patients' outcomes are really dictated by what happens out in the community, with only 20% of what happens within the four walls of a hospital institution. Two of our partners that we've built a very close relationship with are our community paramedicine partners in both Empress and the Scarsdale Volunteer Ambulance Corps. Now, with our community paramedicine partners, we have leveraged them to be able to perform in-person visits along with our telehealth visits for some of our most vulnerable patients.
Our home visits allow patients not to have to go to the emergency room when it isn't necessary. And reinforcement from somebody coming out telling them that they're going to be okay is what works.
Specially trained paramedic, coordinated through White Plains Hospital, is sent to see a patient that's been risk stratified through the clinical departments in the hospital, or have had a past history of multiple readmissions, high ER utilization, to see if we can develop a plan for keeping them healthy and navigating them to more appropriate health care.
The health fair started with the Slater Center, White Plains Hospital, Calvary Baptist Church, and El Centro Hispano.
The health fair is successful because it's a collaborative effort with all the stakeholders of our community.
It involves a lot of participants, not just only from the community, but also from within our hospital. People came from all different parts of the hospital, different departments, to volunteer their time, to be there to make a difference.
All the other health fairs in Westchester, they just provide information. We provide services, we provide tests. You see, it's incredible.
Actual examinations take place to look for people that have markers or are showing signs of illness and make sure that they get into treatment.
One of the health preventions that we do is something called See, Test, and Treat. It was a grant that we got from the American College of Pathology to do cervical cancer screening on women. It's a great program. We've been doing it for a couple years. We do an average about 50 to 75 women.
I am the liaison between the patient and the healthcare system. So El Centro Hispano is one of the large organizations that we work with within the community. I receive a large portion of my referrals from them, as well as the Family Health Center. I can receive up to about 20, 30 calls a day to schedule the patients and to facilitate times and dates for them, which may work best for their work schedule or childcare barriers. With the help of community organizations, I couldn't do what I do without them.
We have so many testimonials of people that they come and they say, they saved my life.
The health fair is where trust has been built.
Bringing them to White Plains Hospital, we can plug them into our Family Health Center, which is part of their community. And so now they're handing them to us to continue that trust.
The Family Health Center sees about 14,000 patients a year. It's part of White Plains Hospital, and we serve many of the population that are uninsured or underserved. We try to connect them to those resources. One of them is we collaborate with Feeding Westchester, and we have a food pantry, so every patient is screened for food insecurity.
If individuals are considered food insecure, then they're referred over to the pantry, where you have one of the White Plains staff members assisting them with selecting food that's appropriate for them.
We're able to serve an average of 250 to 300 patients per month.
The food pharmacy is vital to the community. Individuals rely on it. It just indicates the importance of what we are doing.
So whether it's food, for housing, for insurance, for their medications, behavioral health referrals. So there's a lot of resources that are utilized for the patients within the clinic.
Dozens of 7th and 8th graders in White Plains were taught how to perform CPR and what to do in an emergency. In 2018, we formed the Healthy Community Initiative with the hospital and other stakeholders across the community. And what we do is we come together to identify issues within different populations and try to develop solutions. One of the pillars of the Healthy Community Initiative is economic stability. And when we came together as a group, we wanted to focus on the youth and creating stability for that next generation.
So when we're thinking about wellness, overall total wellness, the hospital's been part of the conversation here in White Plains and indeed in the schools as well. So whether it's during a career day or whether it's talking about a medical intervention that could be employed in case of an emergency, or whether it's just exposing students who are interested in the medical field to practitioners, these are all avenues that continue to strengthen our community.
We do a program at White Plains Hospital called Career Pathways. And we often have staff from the hospital speaking to young people at the hospital about a variety of careers. These are kids who come from poor socioeconomic experiences and background, and we want them to overcome those barriers and stressors.
With the Black Men in White Coats Youth Summit, it brings young people from around Westchester County. We had a waiting list last year, and it's a simply awesome, fantastic day.
These kids from middle and high school, they were very engaged. I saw it, the happiness in their eyes. At the end, they would not stop asking questions. They wanted to know more, and they wanted to get more information, and I felt like I was able to reach them.
Our belief is, if they can see it, they can be it.
Mercy College and White Plains Hospital are working together by trying something new when it comes to providing education. The arrangement is to essentially invite White Plains Hospital into the college to make sure that we understand exactly what they needed students to know. Our students are very excited about this arrangement. They get a kind of sense, as you might expect them to get, that something special is going on. It is a much more closely tied arrangement between a college and the workplace to make sure that they know exactly what they need to do to be successful. That I tell you is a radical and a revolutionary idea that's going to spread more and more in the future.
Well, over the last decade, White Plains has expanded significantly, and certainly the hospital has been expanding not only to meet the needs of the city of White Plains, but the needs of the greater region.
We have countless organizations that support us, that help us to be able to provide that exceptional care to our patient. And that relationship, those connections, those partnerships are critical to being able to keep our patients, our community well and healthy.
What I think makes the community unique is the fact that people know each other by their first name. People pick up the phone and call each other when there's an issue. That personal contact is what makes people confident about seeking help.
It's just part of the fabric of the city of White Plains.
I have never seen a place that you are able to work together with everybody, even though there are different peoples, different ways of thinking.
The school, the hospital, the city, all the organizations. That's the beauty of White Plains, that we all work together, we love each other, and we're successful.